On this episode of Bondi Vet, Danny helps a much-loved moggy with a serious knee injury.
Definitely some swelling in that joint there.
Scott's most dangerous patient needs urgent surgery.
Ooh, yowza. To find something that looks that angry and that nasty is a massive cause for concern.
What do you got? I think it could be a python.
And Tim gets into a wrestling match with a snake down a drain pipe.
I'm going to call in reinforcements. My arms are jelly. If we pull too hard, we could break his back. Strong? Yeah, man.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
Hi Peter, how you going?
Good, how are you?
Good, good. Hey little Jerry. Hey little mate. Oh, you've been nervous in there. Do you want to come on through?
Yeah, sure.
Jerry's come in today. He's a 3-year-old cat and apparently he's become suddenly lame in his left hind limb. So we'll have to find out what's going on today. Hello. When was he last walking around normally for you?
Like yesterday.
Yesterday, okay.
Yeah.
I might admit him and just get some x-rays, have a good feel with a bit of sedation or anaesthetic, and then I'll give you a call and let you know what we find and we can make a plan from there. Does that sound good to you?
Yep, sounds fine.
Okay. Come on, mate. Let's see what's going on with you, hey? You good boy.
Oh, he's part of the family. You know, he's there when we get home, he greets us at the door. So he's pretty cool. We're worried. Yeah.
See how much you weigh. You good boy. 7 kilos, mate. I think we're a little bit on the tubby side. Hey, we might need to work on that, I'm afraid. There's definitely some swelling in that joint there. Can't see any obvious trauma that would imply that we've been hit by a car. No damage to the skin. All right, mate. Well, let's just pop you down and see how you're moving around today. All right. So put Jerry down on the floor just to see how bad this lameness is. And poor Jerry is so stressed, he just is trying to hide. So it's really hard to interpret how bad these injuries are. With all that adrenaline, he's just hiding anything that's going on. I'm really worried about that leg, so I think we'll just get some x-rays, put him under a general anaesthetic so he's not so stressed. And then if we do need to go to surgery, we're ready to go. X-ray. So having a look at the x-ray of the knee, I can see that we've got an area in that joint that is whiter than it should be. It should be really black. So it does suggest we've got swelling inside the joint. And I don't think that the kneecap is the answer. I think there's something else going on in this joint. So we're going to have a feel to see what's going on. I feel that patella's just floating around there. Oh yeah, this joint has got a lot of laxity in there, so I think we have ruptured that cruciate ligament in there, unfortunately for little Jerry, so he's going to need to have surgery to fix that. I'm quite worried about how the anaesthetic is going at the moment. Jerry isn't wanting to breathe for himself, his blood pressure's low, we really need to get this under control as soon as possible.
Yeah, try to elevate the chest a little bit more.
It's just a balancing act of making sure he's at an appropriate level of anaesthetic for surgery.
Yes, it will be.
But I think we've just got to keep working on stabilising him at the moment because we're not in the ideal situation right now. Now that we've started the procedure, breathing rate, heart rate, blood pressure's all stabilising now, so we're finding a better balance with our anaesthetics, so that's really good. So we're just approaching the knee joint just to make sure there's no damage to the cartilage inside the joint. And once we're clear of that, we're going to place an implant in that knee to help stabilise the knee joint so Jerry's got full function of that knee again. Good boy. We'll take care of you and then you'll be going home very soon, okay? So this is definitely a big procedure that Jerry's had today, but he's going to be feeling a lot better on that leg straight away, which is wonderful now that that knee is nice and stable. But he will have to rest up for a little while, just until everything heals up, and then he'll be hopefully jumping around happy again after that. Hey, what do you think?
Come on.
3 months later, Jerry has made a full recovery and is enjoying some much needed exercise.
Good boy.
Oh, Scott, have you seen who's coming in today? Your favourite?
The clinic's most feared patient is booked in later today.
It's always quite concerning when you see "must be muzzled" on their patient
in
card.
bright red. Yes, gauntlets at the ready, but fingers in your pocket.
Yeah, awesome. Every 6 months or so, the word "bam bam" will flash up on my screen, and yes, it's always a day that you know that the adrenaline is going to be flying high.
Just a short distance away at her home in Richmond, Sheena is getting Bam Bam ready for his outing.
What are we going to do with you, eh? You who doesn't like to get groomed.
Hard to believe this sweet, shaggy angel turns into a demon when confronted with a set of clippers. Not even Sheena can brush him.
You feel really defensive because you know he's a wonderful dog and you know his gentle side, you know how loving he is. All they see is this gremlin that comes in the door. It's really embarrassing. Come on, Bob, come on, come on.
Bam Bam's bitten his owners. The last time Sheena's partner brought in the dog, we had to send him to A&E. That's how serious this dog wants to injure anyone that is doing something that he doesn't like. Morning.
Good morning.
Morning.
How's trouble?
He's
Hi, Bam Bam.
wound himself up quite badly
Oh, is he?
already. Yeah, he's shaking like a leaf. Can you see him?
Okay, oh dear.
Yes. You'd have thought by now he'd realised you're not going to kill him. No.
The moment of truth has finally arrived for Scott. His nemesis Bam Bam has entered the building for a haircut.
Sometimes when I take him in, he is very long and hairy, and it's not because I'm negligent, but I can only have him anaesthetised a couple of times a year. People say to me, surely you can take him to the groomers and just give him a sedation. And I'm like, no, you don't understand. Because even under sedation, he's still growling, right? And he's trying to fight for his life. So whatever anybody did to this dog, historically, they did a real number on him.
So far, Scott is the only vet who hasn't turned Sheena and Bam Bam away.
Mum's a bit upset today. She doesn't like to bring you in, you know that. The reason why Scott's been so amazing is he's never thrown me out with Bam Bam, and what Scott never did is he never judged me. Bye, BB. Bye, hon.
Bam Bam, come on then, buddy. Let's go. Good boy.
He's shaking. Look at him, poor little thing. He doesn't realise that I have to do it because he's a dog. He doesn't understand. Please give me a dog back at the end of the day because he means so much to me.
I'll look after him well, and we'll give you a call once he's woken up.
Okay, thanks a lot. See you later.
Okay. Bam Bam. No.
But as soon as Scott and Bam Bam are alone,
No.
hostilities break out.
No. If he came in growling, everyone would know where they stood. Don't be nasty, come on. But because he comes in very calmly and then launches within seconds, he is an exceptionally dangerous pet. Oh, no. Don't be horrible. No. Stop that. I think we're gonna need some more drugs today. Right, so we'll do our usual technique. Okay, I'll slide this through the door.
Scott has to literally treat Bam Bam like a wild animal to sedate him. It's primitive, but effective.
He's fearful of me, and I'm definitely fearful of him. Okay. See what happens. Come on. Ooh, yowza. It's always a day that you need a stiff drink when Bam Bam comes in. A bit dozy. Yeah, those drugs kicking in. Right, okay.
Finally, Bam Bam appears to be docile enough to be handled.
Just Just always be careful. You remember this guy actually growls in his sleep.
Even with the muzzle on, your adrenaline is pumping high.
You should keep a very close eye on the depth of this anaesthetic for our safety as well as his.
My heart's pounding. I'm shaking a little bit. I've still got to do my job as well as trying not to get eaten, so nerves on tenterhooks.
So, do you want to do the fur and the feet?
Yep.
And I'll do the body bits.
All on you.
While Bam Bam is under, Sheena has also asked Scott to clean his teeth.
Have you done any hairdressing before, Anne?
No, can you tell?
Yeah.
I've never claimed to be a groomer. A shearer, however.
He's a very, very, very good vet because he puts animals first. He's empathetic to the owners, but what I see about Scott is that his real concern is for my dog, you know, and to make sure that he's okay, and that means everything to me.
Dental's all finished down this end.
Scott's now completed Bam Bam's dental work, but Emma has discovered something worrying.
Scott, he's just got a bit of a situation on his tail here.
Whatever it is, it doesn't look very nice. To find something that looks that angry and that nasty is a massive cause for concern.
The problem is the mass is so large that once removed, it will leave a wound that will be impossible to close. A mini amputation is the only answer.
Hello, Scott.
Hi there, Sheena, how you doing?
I'm okay.
Okay, so look, that tail lump.
It came up very, very quickly.
Scott's now seeking permission from Bam Bam's owner, Sheena, to go ahead with surgery.
So I always say it's best that we remove it straight away.
What do you mean?
Actually take the end of his tail off.
Oh my goodness.
Sometimes being a vet is about offering up decisions which are difficult. And to say, I'm going to take a section of your dog's tail away, no dog owner is going to feel good about that. There's nothing good about that at all.
Is it going to be in a lot of pain?
I don't have any concerns regarding pain.
Okay.
Okay, all right, trust me, and I'll give you a call as soon as you've woken up.
Okay.
All right then, see you later.
Thank you.
Bye.
As soon as Bam Bam's grooming is finished, Scott takes him into theatre to remove the tip of his tail. Emma and Scott have been working together for 7 years.
A lot of people do say behind every good vet is a good vet nurse. I know what he wants before he wants it.
I don't want to take off any more tail than that.
A sample will now be sent to the lab to find out if the lump is malignant.
Boy, let's put you back in there while you're still being a good boy. Sheena's a great owner, but I suspect that she's going to be in bits when she comes to pick up Bam Bam, and I just can't reassure her. At the moment, I just simply don't know. It could come back as something absolutely fine. It could come back as really bad news, so we just need to wait and see. It's one and only time I get to pet you. It's quite nice.
Hi.
Sheena, you all right? Let's
can
get your
be.
boy back.
A short time later, Sheena and her partner Neil arrive to pick up Bam Bam.
Come on then. Good boy. That's it. Good lad.
A sample from the lump on his tail has been sent to the lab for analysis, but it will take several days to find out the results.
Here we go. Out to see Mummy.
Sheena is still very shaken.
B. Oh, he's coughing, is it? Because he wants to get to me.
I knew she'd taken it badly, but then to see the reaction of her to actually collapse on the floor like that, I've never seen anything like it. How are you feeling about everything?
It's scary. It's really heartbreaking. And I had to take a couple of tranquilizers that then made me really think it was a dream after I heard about the tail.
So we'll be sending it off to the pathologist. I know you're worried about it, but it's something that we'll have to just hold fire on concern for 3 days and wait until that result comes back.
Okay. Taking a little piece of him off is traumatic. He doesn't understand it.
Take care, all right, no worries. See you, buddy. Hi, Sheena, how are you?
Hi.
Good to see
As
you.
for Sheena, she's been anxiously waiting for Bam Bam's lab results.
Grab a seat.
It's been 3 days since Scott removed a nasty cyst from his patient's tail.
Oh, he kind of knows who you are.
Already not so keen, is he?
No, he's not.
I've not got a scalpel on me, I promise.
Come on, Bubs.
I've got some good news for you, okay?
Yeah.
And that the results have come back that the mass is benign. So, in other words, nothing nasty, nothing to worry about.
I'm so relieved.
Yeah.
Thank you so much.
No worries.
And you know how much I love this dog. I'm so happy. Are you happy to hear that?
Sheena reacted brilliantly. You know, she's massively relieved and she can go on living with Bam Bam for a very long time and Bam Bam can go on tormenting me. I never thought that I was a very good dog stylist until you now have matching haircuts. I must have done something right.
Funny.
Well, next time I do them, you should come in. I'll do a 2-for-1 offer.
Absolutely. That would be really, really nice.
Great to see you.
You too. Thank you so much.
pleasure,
Really
my
appreciate it.
Wow.
How you going, Chuck? Come on. Come and see the bird vet, because I'm not it.
At the Bondi Referral Hospital SASH, it's an unusual role reversal for Dr Andrew Marchevsky.
I know.
Today, he's not the specialist surgeon. He's the worried pet owner.
Meet Ducky.
Hi, Ducky. What's going on with Ducky?
She's got a lump.
Okay.
Andrew is hoping avian specialist Dr Alex Rosenwax can provide some answers.
It feels a bit lumpy and swollen around there.
Doesn't seem to hurt her, but it's... Oh.
It's going to be a little bit uncomfortable though. Yeah. What I can feel in there is a sort of oval-shaped lump, almost the shape of an egg, high up in the abdomen. So we see this quite commonly in chickens.
Yeah.
Because chickens lay a lot of eggs, they often get a swelling in the area of the uterus.
Yeah.
There's a couple of main causes. Sometimes an egg gets stuck there or just a yolk.
Yep.
Sometimes they get a cyst in that area, but unfortunately, sometimes, or more commonly, we might see a growth or even a cyst or cancer forming there in the uterus or the ovaries.
That's no good.
And you're right to be a little bit worried.
Yeah, well...
Is that we're worried that there could be a cancer that we need to go into.
Okay, all right. I'm not really used to being in this sort of position because normally people come to me and say, here, fix my dog or cat, and I'm no bird vet, so I feel like I'm on the other side of the table today, which I guess I am. I'm really quite worried about Ducky. I know she's just a chicken, but she's my chicken. I really don't want her to be sick. All right, so what do we have to do?
What we'd normally want to do is do an X-ray and make a decision on what to do.
Alex wants to take some x-rays so we can find out exactly what we're dealing with, and I guess I'm hoping we don't find cancer because that's really about as bad as we can get for Ducky.
Just pop her down there.
We're going to have to anaesthetise her or hold her down or something?
No, we're not going to need to do that. We're just going to hypnotise her.
Oh, okay. I've heard about this.
Yes.
I'm hoping what we find is just a benign lump, because if that's the case, it's a simple fix. But I'm worried about it being cancer. And, you know, Ducky means a lot to me and my family, and, you know, I'm really quite concerned.
Wake up, Ducky. Oh, there you go. All right, let's have a look at those x-rays.
Yeah.
Okay, that's the lump.
Yeah.
And when you look at that lumpy area there, that's the white area there, that's where the uterus is. So we've got a swollen uterus. When we look at the bones there, there's not a lot of calcium in there.
Yeah.
Unfortunately, that points more likely towards a cancer of the uterus.
Poor Duck. You're making me sad. As soon as Alex tells me that Ducky has cancer, my heart sinks, because I really don't want to lose my chook.
It's a grim diagnosis for 3-year-old Ducky.
Uterine cancer is very common in chickens because they lay a lot of eggs, so there's a really fast turnover of cells in the area. And that's why chickens of all animals who lay eggs daily get a lot of cancer. Fortunately, because it's so common, we've also developed techniques to deal with it. And although it's life-threatening, if we get it early enough, we can usually treat the problem. So my plan for Ducky is that we're going to put an implant into her.
Right.
Which lasts about 4 to 6 months. It's going to shrink the cancer down. And she'll need some oral medication as well.
The bottom line is that unless we treat Ducky, she's going to be dead in a couple of months. With the treatment that Alex is suggesting, he says that she might be around for a couple of years, so I'm going to hold him to that. Hey, Ducky, we'll see if we can get you sorted today.
Once she's asleep, we're going to roll her over and we're going to put the implant straight in.
Ducky's concerned owner Andrew knows that although the procedure is quick, it's also incredibly risky.
The problem with anaesthetics and birds is they can get deep really quickly, and the next step from deep is dead. So we've got to be really careful and really quick and get it down, get it done, and get her awake.
Andrew hopes the implant will help shrink the large tumour in Ducky's uterus.
So just into the breast muscle. So what the implant does is it actually tells the brain it's not breeding season, and that sends a signal to the ovaries and the uterus to tell them to stop growing, and that usually shrinks the cancer. There's a big blood vessel there, we've just missed it, so that's good.
With the implant now in place, Ducky must be taken off the anaesthetic immediately.
Turn her off? Let's turn her off. Yeah. Give her a flush.
Right.
And wake her up.
Turn it back over.
Just turn her on the side.
Are we there yet?
Okay, let's just, there we go. Eyes are starting to open and she's coming back to us.
All right. There you go, chicken. You awake? Are you awake?
All done.
Ducky's starting to wake up from the anaesthetic, and I'm breathing a big sigh of relief. I'll give you a bit of food. Hey? How long will it take before that starts to
It takes
shrink?
about 2 weeks before it shrinks, and you'll see the main effects after about a month. Really, the implant lasts about 4 to 6 months.
Alex has given us quite a good prognosis, but I'm going to have to monitor her to just see if this tumour does shrink away, because that's the only measure of success we've got, and obviously that's what we're after. So in another month or so, we'll know a little bit more about how things have gone. All right, Ducky. Get you home a bit later, shall we? It's all right. Look, see? I bought some food for you. Brekkie time for Ducky and crackers.
It's been just 4 weeks since Andrew's pet chicken Ducky was treated with an implant to try and shrink a tumour in her uterus.
So do you reckon these guys are good mates, Crackers and Ducky? Yeah.
Now the off-duty surgeon and his daughter Phoebe are keen to see if the procedure has been a success.
Ducky's actually been better since we've treated her. There wasn't much difference for a week or so, but I definitely think she's put on weight and she just seems to be a bit more interactive. So I think she's doing well. We're going to see if that lump's gone. Ooh, I think it has. How's that? That's good, isn't it? Wow. Well, that's good. We got you around for a little bit longer. Aren't you lucky? Hey? A lucky ducky. Feeling her abdomen, I can't feel the lump at all. It's gone. She basically had a cancer that was going to kill her unless we did something. And we've treated her and she's come good. That's fantastic. So she'll be able to wander around the backyard and stay a part of the Marchevsky menagerie, and that's a fantastic thing.
Hello, Tim speaking.
Hey Tim, it's Tara from next door. How are ya?
I'm good, how are you?
A bit better. I'm glad you're at work. I was just wondering if you could come and give me a hand. I've got a little friend and I can only see his tail. I'd hate to imagine how big he is.
Should I come over now?
Yeah, that'd be great.
Okay, I'll be there in a minute.
Thanks.
Bye.
Australian Reptile Park General Manager Tim Faulker is responding to a call from the family that lives next door to the park.
Don't let him go, Pop.
They're worried about a snake which has wedged itself in a drain pipe.
Dad's got the snake and hopefully he's holding on and Tim will hurry up and come and save us.
What do you got?
Oh.
I think it could be a python. Oh, spot on. This is where you found him?
Yeah. It's just his tail was sticking out.
This is going to be a pretty big snake. You can only see the end of him. Well, I can see it's a diamond python. That part's easy. What I can't see is how I'm going to get it out of there. I don't want him to get down the pipe. Not sure where it goes. If it rains, he could drown. Worst case scenario, he'll pop up through the toilet. Who knows?
Get him out, thanks.
Okay, I'm going to start, and just one bit at a time. You can't pull too hard because all the little vertebrae in the back, you don't want to hear them crack.
Yep.
So it's just a little bit at a time. Oh. I know right away this is not going to be easy. I can't tell whether his head is hooked around something or if he's just wedging his body in that pipe. Either way, he's not moving.
Wow. I didn't realise they were so strong.
Yep, very strong. I don't know how I'm going to get him out.
Come on.
Every time I pull and then I relax, he takes back what I've got.
Yeah, we wanted this diamond python moved, hopefully into the bush, so then it can't hurt our chickens, or we've also got dogs too, that we don't want the dogs to, get the snake either. So hopefully we'll get him out and he'll be right.
Come on, you gotta get that snake out.
I'm trying, guys.
Look at it wrapped up around Tim's arm.
I'm struggling. I'm in full sun. My arms are starting to shake. I can see sweat dripping off my nose.
Here, Tim, may as well get comfy.
Hey, thank you. Oh, that's better. My arms are shaky and sore.
Well, I'm no good.
After more than 10 minutes, Tim is losing the battle to get the trapped snake out.
Really, I might get you to run over to the park.
Yep.
And ask for Billy, please.
Bill.
Yep, and just ask him to come over.
No worries, we'll be back in a
Thank
sec.
you. I'm going to call in reinforcements. The last thing I want is for this snake to slip, and he's gone. I can't get him then, or it's going to be a lot harder. I'm calling Billy. Hey, mate, have a go at him. Grab on. My arms are jelly. Thanks, mate.
Jelly?
They're jelly.
He has a strength in it.
Yep.
Diamond pythons, these things are strong. We've got a serious fight on our hands.
Strong?
Yeah, man.
I got an idea, mate. I think we pour a bit of water down there. It's not going to hurt him.
Yep.
But it might make it slippery. Might give us the advantage.
Sounds good.
You ready for a bit of water?
Yep.
Okay, coming now. So I hit him with the hose and he starts to move. And maybe now we're up to half the snakes out of the pipe. But again, he's locked in.
You want to jump in again?
Yes, no worries. There's a worry if we pull too hard, we could break his back, separate his vertebra. We don't want to do that. Come on. Come on.
I'll give you a bit of a spray.
Good.
Billy is now putting water down the pipe in the hope of flushing out the stubborn intruder.
This is a diamond python, which they get fairly large, up to 3 metres. I'm guessing that this fella's going to be 2 metres over. Okay, he's moving. Look how big he is, kids. He just keeps coming. He's loosened up and he's coming out. Last bit. Well, he's got a bit of skin off on his neck there. And all of a sudden the head pops out, and there he is. Have a look at him. Do you think he was that big?
Yeah.
You did? What a battle, but we've got him. Well, that was the hardest python I have ever caught. Diamond pythons must surely be one of the most beautiful pythons in the world. They're only found around the Sydney region and east coast of Australia. Now, this male, he'd be out in search of a female or a feed, but the sun's come up. He needs to find somewhere to hide. He doesn't want to be out and vulnerable. He's found the pipe, picked a bad spot. Can you think of a name for him?
What about Peter the Python?
Peter the Python. Okay, Peter the Python it is.
Okay, let him go.
Let's go and let him go. Come with me. Clint takes us to a beautiful spot just off to the side of his property. Beautiful forest, a nice creek, perfect diamond python habitat, and we let him go. Everyone have a quick pat, say see you, Pete.
See you.
There we go. Pete the Python is happy now. He's had a stressful day, but he's out now and he's back in his natural habitat. Hey, what are you going to do if you find another snake?
Go Tim.
Call me. Don't you catch him. Let's go.